Is magical thinking related to OCD? Have you ever wondered if the way we think can shape our reality? Today, we are diving into the connection between magical thinking and obsessive-compulsive disorder, often known as OCD. Magical thinking is the belief that our thoughts, words, or actions can influence events in the world around us, even when there is no logical link. For instance, some people may think that if they imagine something bad, it might actually happen. This belief can lead to performing specific rituals to prevent misfortune, like touching a doorknob a certain number of times. Now let's look at how this ties into OCD. Individuals with OCD often experience intrusive thoughts that cause them distress. These thoughts are called obsessions. To cope with these obsessions, they may feel compelled to perform certain behaviors or mental rituals, known as compulsions. These compulsions often stem from magical thinking. For example, someone might believe that if they do not wash their hands a specific number of times, something terrible will occur. This belief is not based on reality but on the false idea that their actions can directly affect what happens in the world. It is important to note that magical thinking in OCD is different from common superstitions. While many people have superstitions, those with OCD experience significant anxiety and distress. The compulsive behaviors they perform are aimed at reducing that anxiety. However, these actions often provide only temporary relief and reinforce the magical thinking, creating a cycle that can be hard to break. So, how can we address this? From a stress-free mindset perspective, recognizing and challenging magical thinking is essential. By identifying thoughts that are based on false connections rather than facts, individuals can reduce anxiety and regain a sense of calm. Cognitive restructuring is a technique that can help. This involves questioning the validity of these beliefs and replacing them with more realistic, evidence-based thoughts. By challenging magical thinking, we can break the cycle of fear-driven compulsions. This not only supports a calmer mindset but also promotes mental clarity. In summary, magical thinking is closely related to OCD, as it underpins many of the obsessive fears and compulsive behaviors seen in the disorder. Addressing magical thinking through cognitive techniques can be an effective way to reduce stress and cultivate a peaceful mindset.